Hospital-based physicians are not happy. Key insights. So what makes a hospital-based physician so unhappy compared to private physicians, whether it be in a single specialty group, a multi-specialty group, but basically physician-owned? Let's look at the key insights. Number one, hospital-based physicians have been increasing over time. In most cases, a hospital has come into the local area and said, listen, we want to buy up your practice. If a physician says no, they literally threaten to open up next door and take all those hospital-based patients with them. So often doctors are in a no-win situation. So besides the actual way in which this is happening, let's see why hospital-based physicians are unhappy and why physician-owned practices are doing so well right now. So number one, access to patients. Once there is a corporation running patient care, their responsibility does not belong to the patient anymore. It belongs to making money. There's a fiscal responsibility to their shareholders or to that large corporation that is distanced from access to patients and patient care, which is the primary focus of a physician-based practice, and is, by the way, what makes America's medicine what it is. Despite all its faults, people come from all over the world because the medicine here is top-notch. Number two, decision-making freedom. This is probably the biggest reason physicians are unhappy in corporate America. Hospital-based or private equity-based. When the amount of knowledge and the amount of training that goes into becoming a physician gives that doctor access and responsibility to doing the best thing they can do for a patient, which means they should be making the decisions on patient care, not how much it costs, not whether to stay in this hospital when another hospital might be better for that patient, getting care that may not necessarily be covered at that hospital, but is covered somewhere else. So decision-making, access, and authority is what's making physician-owned practices excel. Adequate staff. So I am in my private practice. I have been successfully for 35 years. When I hire new staff, I am intimately involved with their training and what do I expect of them. I can see their skill set when they start our software, how they answer phones. I know whether to put them in the back office or the front office. This is not how hospital-based staff is hired. Basically, it's an all call and they look at some credentials maybe, and they put that person at the front desk with doctors at the back who have no decision-making ability when it comes to that staff. So there's a disconnect, and there is no connection to do better for the patient between the doctor and the front desk. This is not so in physician-based practices. Surprisingly, a lot of physicians went to hospitals thinking, hey, we always have enough supplies and top-notch equipment. 3 years into this, we are finding this is exactly the opposite. The supplies are slow to get in. These are big hospital systems. They're not adequately supplied, and replenishing that supply for all these multi-specialists is very, very hard. I will tell you what has been very successful in my practice. Amazon has a wholesale procurement for all physicians. You sign up as a physician, you get wholesale pricing. Right now, that wholesale pricing are the same supply houses that I've used individually are now supplying Amazon before they supply their own houses. So I literally can order something and it's in that day or the next day, and you have wholesale pricing. You can check that across even a regular Amazon site and also your supply site. So Amazon has added that on and it's available for physicians. I have no problems in my office and many of my colleagues in getting adequate supplies. Efficient workflows. So let's talk about this. Hospital systems are huge. They are designed for staff, for nurses, and for doctors with multiple specialties. So when you go into their software systems, as many of us physicians know, you have to now navigate to your specialty because they deal with so many physicians, surgical and non-surgical. You then have to navigate within your own specialty to what is the equivalent of 10 to 15 different pages with different checkoffs. In these private owned practices, we narrow down that software. We sit one-on-one with new software and say, we need this, we don't need this. It's customized from day one. In my practice, I book every 15 minutes. So I see a patient, diagnose them, treat them, write the note, next patient, 15 minutes all day long. And that's because the workflow, the software that's designed is for my practice, what I see the most of, what's required by insurance companies. Billing is done right on the same software, so the front desk gets the codes as soon as I see the patient and finish that note. Very, very efficient as opposed to hospitals. And lastly, let's look at leadership. As we all know, once you enter corporate America, whether it be a hospital, a private equity group, or other, their responsibility is to make money for that hospital or private equity or shareholders. So their alignment is not the same leadership alignment as a doctor. A doctor wants to be aligned to their patient and to provide patient care. So fiscal responsibility, which we all want to do well, but that shouldn't be the priority. It should be running an efficient practice where patient care is put first, along side by side with what's the best we can do for this patient and still align taking care of them at an efficient cost. Two different alignments. So let's review again why hospital-based physicians are unhappy and why privately owned physician practices are excelling in this environment, much to everybody's surprise. So number one, access to patients improved with private practices. Decision-making freedom, number one on the list. The doctor does what's best for the patient. Adequate staff, doctors aligned to picking and working with their staff. Supplies and equipment, doctor orders what they want. And again, I have found Amazon procurement to be unbelievable and efficient. Efficient workflow, that software is designed for that office and for the office to run efficiently. And lastly, our leadership is aligned in a physician practice to the patient first, as opposed to hospitals where it is fiscal first. Hope this helps. Doc Dynasty, I'm Dr. Raval, and in the link is a book for those trying to make the transition if they want, but I am totally committed to keeping physicians independent in this environment. Hope this all helps.